Dr. Kwang Sung. I'm one of the laryngologists here at the Voice and Swallowing Center. I think Stanford is unique in that we offer care that runs the gamut from benign voice lesions such as nodules, polyps, and cysts, to airway problems, to swallowing disorders, and even to advanced cancers of the throat.
I had throat cancer, and it caused extreme scarring on my throat. And so I was unable to swallow, I was unable to eat and drink, and I was also unable to breathe.
Disorders that affect the larynx, trachea, or esophagus can have a severe impact on a person's ability to talk, breathe, and swallow. Not only are some of these diseases dangerous, but they can have a huge effect on quality of life.
Before the operations, you wouldn't understand me. I slurred my words, it didn't work very well. It was very, very difficult. So that has been improved 1,000-fold. I now can eat 80% of whatever I try.
Here at the Voice and Swallowing Center, we offer a true multidisciplinary approach to the diagnosis and treatment of many of these disorders. As an academic and research institution, we are always striving to find new techniques and apply the latest technology to the treatment of our patients.
One of the things we've been trying to do at Stanford is to do more procedures here in the office rather than the operating room. We can use this KTP laser here to treat a number of different lesions on vocal folds while the patient's here awake. We can also do vocal fold injections with bulking agents and steroids. We can even take biopsies of the larynx, the trachea, or the esophagus. A lot of our patients like to have procedures done here in the wake setting rather than having the expense, the time, and the risk of going under general anesthesia.
I was having trouble with my voice and slowly realized that it was actually getting in the way of my talking and my ability to be a doctor. And I also have 3 beautiful little boys who keep me talking quite a bit. And I decided I really needed to look for a really good surgeon who could help me diagnose what was wrong. Often surgeons are very busy and don't have time to call you. And Dr. Sung, I remember speaking to on the phone twice. And he said, you know what, I have an opening in my schedule and I'd really like you to try to fit this into your schedule because I think it's really important that we don't wait. And he helped me understand that I could damage my vocal cords if I waited.
We work as a team with our speech pathologist to provide the ideal treatment plan for each individual patient.
One of my goals as a speech pathologist is to help patients avoid surgery. Although we have terrific surgeons here, if we can resolve the problem with voice therapy techniques, avoid surgery, that is really the best solution. We try to improve the strength of the voice, improve efficiency, eliminate bad habits, yet meet the daily demands that you have. There are times though, however, voice therapy does not work and surgery is necessary. If that's the case, we are with you after the surgery to try to regain the best possible voice.
After the surgery, the team had prepared me that I would need voice therapy, and the team really tailored the rehab to me. And I am much more attuned with my job and my family, and I don't feel the irritation both with my vocal cords but also in my daily life.
The voice is one of the main things that sets us apart as individuals and is a core part of our identity. Eating is not only required for survival, but is also a main source of pleasure and socialization for many people. Our mission is to protect, restore, and enhance these vital functions for our patients.
And guess what? I'm going to retire in 1 month. So there you go. I'm very excited about that. To be in this shape and be able to enjoy my retirement is a blessing.